Guillain-Barré is classified as progressive primarily because initially the disease or the health condition does progress rapidly and can cause even individuals in an acute exacerbation to be on a ventilator, and sometimes beyond just a few days, even into weeks. The good news is that it is fairly rare, with 1 to 2 incidents per 100,000 individuals, and that the majority of people have a complete reversal of symptoms with drugs and with physical therapy as an adjunct to drug therapy or supportive respiratory therapy. We don't know exactly what causes Guillain-Barré syndrome. There's more discussion of Guillain-Barré being related to a virus. You do see Guillain-Barré in some cases being preceded by active pneumonia, flu, Lyme disease, herpes virus, different types of hepatitis, an HIV infection, and in very rare instances, very rare is a key word, from being introduced to a flu virus in terms of being immunized. Again, that's very rare. The classic characteristics or symptoms include muscle weakness, peripheral nerve dysfunction, sensory loss, and ataxia, loss of balance. The characteristics are the exacerbation of symptoms. Progression of symptoms may last weeks and sometimes into months. However, again, these characteristics and symptoms can be reversed, and a person can have complete restoration of pre-Guillain-Barré status, which is very exciting. There are some rare cases of individuals who actually die from the respiratory complications in an acute Guillain-Barré event, and there are some cases of people who do not get complete recovery. They do not die because of the disease, but there is some residual weakness requiring use, for example, of an AFO or a lower extremity brace because of some of the sensory and loss and muscle weakness that has not reversed completely. So PT is involved with this adaptation. So when the person has a progression of symptoms, using assistive devices, ordering appropriate equipment, activities or assistive devices to provide the individual an opportunity to be fully independent or modified independent, such as using a reacher, installing grab bars. And just really, I think there's just, because it's a problem that affects people your age and my age, and it can be quite frightening for the family to see someone be healthy 1 week and then, in some cases, 1 to 2 weeks later being on a ventilator. It can be incredibly frightening. It's scary for the individual going through the process. It's so rare that there's not a lot of information about Guillain-Barré out there in the community. So our role is to provide support, to educate, and to really provide a sense of hope as an individual kind of works towards recovery. I did want to spend some minutes talking about ALS. It's something else that's quite rare, but you see a higher incidence than Guillain-Barré syndrome. It is a very challenging disease because it continues to progress very rapidly, and there's no cure, and we really don't have great treatments for ALS. There is a spectrum of ALS presentation, however, with some having a less progressive form of ALS, and in some rare cases of people living much longer than the normal progression of the disease. Continue. I've worked with somebody as recently as 2 years ago who healthy individual, very active, and less than 18 months after being diagnosed, did die of the disease. There are some individuals with ALS, such as Stephen Hawking, who choose to use ventilators and artificial, to have a ventilator take place of their lungs in order to continue living. Many others choose not to use ventilation or choose to terminate ventilators because there is no cure and you cannot reverse what's happening with ALS in terms of the disease progression. So our role is to help people who are diagnosed with this health condition to certainly over time to provide more support in terms of equipment adaptations and transitioning from more simple assisted device and balance strategies to over time providing power equipment and to provide hope to family and caregivers in terms of hope as being supportive, not this artificial hope that things are going to get better, which is not true. You may not see someone with ALS because of insurance limitations or the PT checking up on them like once every 6 months, or 6 weeks, which is not uncommon, just to do a recheck and a reassessment and to provide that support. I think you really have to really understand the disease pretty well to be, and I think you really have to be grounded when you're working with someone with ALS. I think that's what I've learned. When I say being grounded, what I mean is that you always have empathy, but you're providing appropriate support for that individual and family, and providing again that sense of, we're here to provide you support and to be a resource for you and to help that person keep moving, especially when falls become more frequent. And that's where aquatic therapy can be quite useful to provide a safe place for an individual to work out. There's certainly other ways to exercise without the pool environment, but there is that freedom of movement. I think that's really important. That can be accomplished in that a buoyant environment. But keeping moving is the key, and not pushing into fatigue to set that person back and to put them at more risk for other problems when you induce exhaustion by pushing somebody too quickly or too fast. But it's about quality of life and about working with that individual with their goals and to enhance their quality of life while having this health condition.